Studies in genetics have seen tremendous breakthroughs over the past decade. And one of the most important methods that has led to these breakthroughs is the Genome-Wide Association Study, or GWAS. Levy and Steen report important new findings on the genetics of anxiety. They base their study in a particularly important cohort, the Million Veterans Program, which possesses very large samples of genetic data in military veterans. The unique findings to come from their study suggest that there are a number of loci throughout the genome that exhibit significant whole genome-wide associations with anxiety symptoms. And this is important both because there have been relatively few studies of the genetic correlates of anxiety, but also because, as in this study, other studies are suggesting that it might be easier to find genetic correlates of anxiety than it is for other emotional problems like depression. Task-based fMRI imaging is particularly difficult because it requires an investigator to administer something for patients to do while they're in the MRI scanner. And this has made it difficult for task-based fMRI research to be used in a large multi-site setting. Yang and colleagues report important new findings that conduct such a task-based fMRI study in a multi-center treatment setting for the diagnosis of panic disorder. And their study looks at neural correlates of a process known as semantic priming. The important findings to emerge from this study suggest that there are underlying problems in patients with panic disorder in the neural correlates of semantic priming. Moreover, the findings suggest that with treatment using cognitive behavioral therapy, clinical improvements in the patient tend to parallel neural improvements in these underlying correlates of this cognitive process. These findings are important not only because they tell us something about panic disorder in particular, but they provide guidance for other disorders where there are attempts to use task-based functional MRI to inform what we know about treatment.